Welcome, everyone. We will give people a minute or two to trickle in. All right, so in the interest of time, I'm going to go ahead and get started. My name is Hannah Sawyer. I am the content specialist for the Christopher and Dana Reeve Foundation's National Paralysis Resource Center. A quick visual description of me. I'm a white woman with a brown ponytail. I'm wearing a white t-shirt with a rainbow on the top and rainbow earrings. I'm outside on my balcony. And we're excited to welcome you today to the webinar, We're Still Here, Aging with Paralysis. So I am now going to turn it over to our speakers. Thank you, everyone.
Thank you so much for having us. My name is Cat Fribley. I'm the executive director at Birdability. I am a multiply disabled white woman with purple hair in a bun. I'm wearing rainbow glasses today, and I have a literal hotel beige wall behind me. I am delighted to get to spend time talking with you all today and look forward to these conversations with my fellow panelists.
Hi, my name is Eric Gibson. I'm here in Colorado. Visual. I have on a purple shirt. I'm an African American. I have curly hair, and I'm a T12 incomplete.
Hey, and my name is Priya Ray. I'm a brown-skinned woman with dark brown hair. I'm wearing glasses that have red frames. I'm wearing a magenta tie-dye t-shirt with different shades of magenta. And yeah, I think that's it. Oh, and my background, it's black and it has DIY abled in the left top corner.
Hi, and welcome. My name's Nurse Linda. I work with the Christopher and Dana Reeve Paralysis Foundation. I am a lightly pigmented skinned woman with brown hair. I have clear frame glasses on, a white shirt, and my background is navy blue with the Reeve logo up there in the corner. So welcome everyone. And let's jump right in because this panel is really great. So they got a lot of great things to say. So first of all, let's start out by talking about what new experience you've learned to navigate as a person living with paralysis who's aging. We'll start with the intertwining of physical and mental health.
I think maybe all three of us brought this up at different points. I'm not sure who we were thinking about for this, but I just wanted to say this was one of the major pieces that I was hoping we would get to talk a little bit about, because I think there is such a distinct intertwining of mental and physical health as we age. Our bodies are changing even more than they changed, right? When we had accidents or incidents, and it feels so much like the ways that I am grateful to be alive as a person, right? Living with a disability is front and center. And at the exact same time, I don't think, planned for being an elder, if that makes sense. Like I don't think that I really thought I would get to be in my mid-50s, which is such an exciting thing. But it also means all of these incredible challenges. And I feel like Eric and Priya, you both also brought up this when we were chatting before.
Yeah, aging with disability, it can be challenging, but it also can be rewarding. I work in mental health, and I'm a drug and alcohol counselor. So I use my work, and I use the the resources that's provided to me to help me with my mental health challenges by helping other people. And you're right, like when you're young, you really never think that you're gonna get old, but you start you start feeling it, you start seeing it. And some of the challenges is when you're young, you do all these transfers all over the place, in and out of your chair. And as you get older, those transfers are not as easy as they used to be. You have to use more strength, and you have to be careful. At times, you don't want to have no falls. And I never realized that aging would be so challenging. But like I say, it's also rewarding too. I am happy to be alive and happy to take these challenges on.
So could you follow up on that a little bit about, you talked about transferring, because we had a question that somebody had previously submitted about what they can do to help with their transferring abilities as they get older.
With transferring, me myself personally, I have a van, so inside when I get ready to go places, I just came on a trip from Los Angeles, and the transfers from the owl chair in the plane, the transfers in different Ubers and other people cars, just because positioning. But the more you can have the equipment that you need to help you with transfers, is better for you. Like I say, I just don't like transferring from different cars from different angles.
Priya, you were going to add on to something.
So yeah, I was 29 when I had my injury, and I have a T12L1 injury. So I ended up having a lot of ability. So even if there were stairs, I could like be like a dog and crawl up them, or figure out different ways. But yeah, as I got older, I haven't hurt myself, but I worry about hurting myself because when you're already paralyzed, then you don't want to hurt yourself. And transferring also, I can transfer pretty, like people are like, oh, you were able to do that. And I'm like, yeah, because this is how I live. But, transferring, like what Eric was saying, it every like people are like, oh, will you be able to do that? And it's like everything, sometimes something moves or is different. You have to transfer in a different way. And then you have to kind of figure out how to transfer. So it's, as you age, you kind of want that stuff to be simpler so you don't hurt yourself.
Absolutely. And I'd like to add that many insurance companies are now looking at people with paralysis who are aging, and will pay for more assistive equipment to help you transfer and do these kind of things. Now, when you're out in the car, or like Eric says, you're out in a stranger's car, you might not have your equipment with you, but doing that one transfer without the equipment is not going to be as bad as doing it all the time without transferring equipment. So everybody should look into that. Which brings us up to technology and treatments and how they've changed over time. Would you like to talk about that for a little bit?
Well, the technology has changed a lot, especially for a person that's aging. We, the people that's aging, we have to keep up with technology because, like, even talking to Hannah back and forth about this webinar, I had to keep trying to remember the difference between standard and mountain time. Had to go on my computer and make sure. We had to do a few test runs with this webinar to make sure everything is going right. New technology is very challenging and very confusing for people with disabilities. And there is resources in different places to help with a lot of this technology, especially on the computer. When it comes to other technologies, it is very challenging if you don't keep up with the technology, because it's just going to continue to change and change over time. And you just have to, every now and then get on your computer and kind of teach yourself a little bit of stuff.
Can I piggyback off what Eric was saying? Like the technology feels overwhelming. I think that's about aging, no matter whether you're disabled or not. Like the
Right.
technology feels
That's
super
true.
overwhelming sometimes. And at the same time, as someone with a disability who, and I think Priya, you were mentioning this, like, you know, what I am able to do has changed over time after my accident. So what I was able to do immediately is not the same as what I'm able to do now, which I think plays into the mental health piece of it.
Hmm.
You know, that I think that is very similar for people without disability too. Like your body's changing, what you're able to do is changing, but it has, I think, amplified impact, right? When you have a disability. And in terms of the technology, the thing I would also say is the technology has kind of saved my life too, because the ability to do telehealth visits, the ability to do online therapies, the ability to, you know, meet with other people who have similar issues that I do, and to like really feel less isolated around some of the things that are happening with my body in particular, that are happening with other people's bodies too. That would be so much more difficult to do in physical space in my community. And it is so much easier to do with the technology that's out there for telehealth visits, for that kind of specialized ability to be at home in a real comfortable space and access the kinds of online therapies that I can. And so I just wanted to mention that as frustrating as technology is, it also, I feel like, has opened so many doors in terms of what I'm able to access for my health, and both mental and physical.
Um, yeah. Sorry, let me lower my hand. Yeah, I agree with Kat. Like technology, like like I take some medications and I live in North Carolina. So, I have to see the doctor every 6 months, and televisits are awesome because I was like, I don't really, to get in the car, transferring, transferring, driving there, then, transferring out, getting, then waiting in the doctor's office just to simply be like, okay, this medication that you've been taking for many years, I just have to see you every 6 months, things like that. So I do agree with technology. So yeah, as they're always like saying old people don't think, they don't understand technology, and people always say that. And it is hard when technology changes so fast. And I think when you're older, you're like, I have to learn something else. I have to learn, it's kind of like, I don't know. I just think when you're older, you're like, I've learned. I just want to live type of thing. But it is beneficial to learn um, what's happening right now. Technology is changing really quickly, and it helps us too. So it's beneficial for us to learn about it for sure.
Absolutely. And what about getting out in the community? That's such a problem.
Mm.
You guys have all mentioned getting in different vehicles, getting around out in the community. How do you think that community connection affects mental health?
Well, I live in Colorado, so being outdoors is all about Colorado. Everything here is about Colorado, is about outdoor stuff. And I love being out in the community. I like other people to see me out in the community and hope that inspire other people to come out. I like to go fishing. I like to go. It's a nonprofit organization that I'm a part of down here called Outdoor Buddies, where they help you get out and go to up in the mountains and do hunting and ski shooting and stuff like that that we normally wouldn't be able to do on our own. But I think it's very important that we get out in the community and still be part of the community as we age, just to show people that's coming behind us that we have to still communi- communicate and be out in the community to let others know that, this is what it's all about. Like, it's not about just being stuck up in the house all the time. We just because we aging don't mean we can't go outside and still be part of the community and affect change that way also.
I Oh, I was just going to say, I love that so much. You know, I said that I'm the executive director at Birdability, and I'm so grateful that I get to work at a place where it's all about creating community and access for people to be in nature. And, you know, one of the things that has been so essential for my physical and mental health is birding, is being outside, is finding something that I'm passionate about and then connecting with a whole community of people. And it's not always easy. I think everybody knows some of the barriers that exist to being outside with a disability. And so the sort of finding a community of people for whom access is top of mind, and we're like doing this and figuring it out together. We're finding accessible outdoor spaces. We're using adaptive equipment. You know what I mean? We're finding ways to be as much as possible um, in that space for each other as well as for the joy of birding. And I think that that has been so important, again, to me, to find sort of like my disabled community within my birding community, within my physical community. All of them are important. And when you can make that work, like you were talking about with the Buddies program, Eric, it's like it makes such a huge difference
Yeah.
for physical and mental health, in my opinion.
Yes.
Okay, yeah. So I'm not really an outdoorsy person, even though Asheville is like Colorado, it's mountains and hiking trails and all that, the same activities. But I am an artist and a musician, and so where I've done a lot of accessibility consulting for the Swan Clay Studio where I make clay. It's really not ADA compliant at all. And they just had me go around in the wheelchair and check, to go through to see what I could do because they just didn't really know. And then I helped them create a table for a for a throwing wheel because they're doing classes for vets. And so I was like, hey, maybe you need some accessibility consulting because you're possibly going to have a vet in a wheelchair that wants to throw on the wheel. So that's what I do. But I also found, even if it's not completely accessible, what I love about it is it's just a really great community because they're always like, don't hesitate to ask someone to help you. So if there's like an area that I could get to. I'm very stubborn too. Like I go in my wheelchair and go in places that I perhaps shouldn't even try to do. But I try to do it. But sometimes I'm like, I don't feel like doing that. And everybody's really nice. And then sometimes I find the older women, because they knew I did the accessibility consulting, they're like, you should tell them they need an accessible parking spot. And I was like, okay, but you should tell them too. You should tell them too, because you do take classes and that is accommodating to you and you have the right to that. So, it's like you don't have to come to me to tell them, you should tell them. So it's just funny how I even have to like educate people that maybe don't identify as being disabled because they've just aged and they got a hip replacement or something like that. And, so it's I find that interesting actually.
Well, we have a couple of comments from some people who've written in, and one lady says she relies on Zoom and smart plugs for many things now, and that's a great tip for everybody. And then another person writes in, when I think of technology, I think of devices and wheelchair improvements, bathtub lifts, ceiling lifts, which did not exist earlier, which some of those things you can get pretty readily from your payer. And sometimes it's a little bit more of a challenge, but never give up. Keep going back, keep going back with the appeal because that helps a lot when you do that. But there's a question. Is there something new for transferring? As I've aged, I can no longer do it. Does anybody have any suggestions for this listener about something that he can get to help transfer himself?
I have seen on the internet these devices that just kind of lay flat down on the ground, and then there's like a remote control to lift you up to a certain height to help you from the bed or even from the ground or the chair. I don't know what's the name of the device, but if you go in on the internet or Google and type in devices to help you transfer, it possibly will come up.
Are you maybe thinking of the Hoyer lifts, Eric?
No, not the Hoyer
Not the
lift.
Hoyer? No,
This is
something
something,
different.
no, this is something different. This is something actually brand new. I never seen it
Oh,
before, but it runs all by remote control, and I don't know the name of it. Like I said, if you Google it, you specifically say something to help you with transfers, you probably can pull up a few things.
And isn't that wonderful that we have access now that if you have, I need help with whatever, and you
Right.
can type that in and you can see all kinds of products, you can see videos of what other people are doing. Doesn't mean that that's going to be the right thing for you, but it certainly gives you a lot of good ideas, doesn't it? We
That's the
mhm.
live in a
beauty
good,
of technology.
Yes.
yeah, we live in a great time for that kind of thing. So, talk about some of the unique challenges that you have encountered and specific ways that you've navigated those. And I know we talked about this previously, and some of the things that I know that were mentioned before were cancer screening and how to get accessible locations and equipment. And one of you had a raging passion for this. So go ahead and tell us about it. How did you conquer that? Because it's a challenge.
I don't know who that is.
Well,
I'll just talk about first of all, my doctor always is like, are you going to get a mammogram? And I always tell her every single time, no, I'm not getting a mammogram because it's inaccessible. I have chronic pain. I don't feel like shifting my body in weird ways to make my breast fit into a machine to get that scan. And then I had to get a pap smear, and I, of course, I didn't want to get it, to be honest. I'll be honest, I didn't want to get it because I always feel these exams are so invasive. But so my excuse was like, you don't have an accessible table. So the nurse was like, oh, I'm going to find one. And then she's like, oh, yeah, the table goes up to here. And she kind of showed it on her legs. And I was like, all right, I'll do it. But then when I went in, I was like, it's kind of higher than what you described to me. But I was like, all right, I'll do it. And it was really nerve wracking because they got me on, they didn't have me take all my clothes off. They kind of just had me do it and put my feet in the stirrups with my shoes on. And then they were like, move further, closer to the edge of the table. And I'm paralyzed, right? So when you're paralyzed, you're really about controlling the environment you're in so you don't fall. So you're just like, so it was really scary for me. And they were just like, oh, like, move a little further to the edge of the table. And I was like, all right. I mean, if I fall, and they're like, oh, we'll hold you up. And it was just the nurse and the doctor. And, I'm
Mhm.
not a light person. So I'm like, okay, I did it. But, it was really frightening. And I had just gone through a hurricane. So I was kind of like comparing it to being in a disaster, it was a similar feeling, to be honest. So
Mhm. Priya, I am so right there with you. So one of the things that is different about me is I have some ambulation still, despite the ongoing changes in my ability to ambulate. And one of the things that happens is that then there's not, how do they not put something in my chart when we do this every single year where I'm like, I can't get on that table. I can't get on that table. I need, if we're going to do something, it has to be very low, and so what ends up happening is they book me in a regular exam room, and then the doctor has to go figure out, like, is there a procedure room that has a table low enough? Is there a different place where we could make this happen? And it just feels like that incredible frustration of having to advocate for yourself over and over and over again to get something you don't even want, as you said, Priya. Like, nobody likes that experience. Like, and so it really sucks when you have to be so like out vocal to advocate for yourself to get something that should be really basic healthcare, you know and also the tables, how they got better by now. When we think of like all of the technology that we have in the world, I know that there are tables that should be able to do this, but so many of our medical facilities haven't invested in adaptive and accessible exam tables yet. And that is, it creates a barrier. It creates a barrier emotionally, and it creates a barrier physically.
Yeah, I
And
actually, after that experience, I'm sorry, Eric, I just want to
go
say,
ahead.
I actually went because the nurse was like, oh, if you write them, we've
Mm,
complained, they don't listen to us. So I went and I Googled accessible exam
yeah.
tables, got the website and emailed them. And they wrote me back a few weeks later and they're like, oh, thank you so much for telling us. We've ordered it. It'll be here in 6 weeks. So I was like,
Thank
okay.
you so much for doing our job for us.
Yes, exactly. Go ahead, Eric.
And
I'm so sorry.
everything that everybody's saying is so true. I just recently went to get glasses, and it's this chair they wanted me to sit in. And 20 years ago when I was younger, I could have did that transfer. Now that I'm 57 going on 58, I didn't even want to attempt to try that transfer. So now we got to go into another room. Maybe a couple of months ago, I had to do an MRI. Transferring on the table, it was scary. And then once you get on the table, there's no cushion under the part where your butt goes. So you sitting on this hard, cold table, possibly maybe can be, breaking your skin down. And, it's just they don't have the answer for it. They don't know, they don't understand. They don't have the right equipment in some of the hospitals. I was just at the dentist, same thing. It was time to transfer into the dentist chair, but the arm don't move around. So now I got to transfer over the arm. And I'm telling them I don't feel comfortable with doing that. And they like, most people always are willing to help, and that's fine. You can get help, but in the process of getting that help, if I wind up falling and hurt myself, now it's like you helped me to hurt myself. With
Mhm.
which I think is so simple to have the type of equipment that the arm move away so you could do the proper transfer and trying to transfer all over that arm. It's just a lot of places. I guess when I was in LA and I was at Rancho Los Amigos Hospital, and you go there, everything is accessible. But when you at other hospitals and doctor offices, they don't have the right accessible equipment, and it is challenging advocating and letting people know and not being ashamed or embarrassed to say like, man, I can't do that transfer. We have to figure this out some other type of way. And maybe it do bother you a little bit because you could do that transfer 10 years ago, but that's something we need to advocate about altogether.
Oh yeah, exams are always inaccessible and dentists are always inaccessible. So
Right. Yeah.
I'm just
And
like, you
as
got to
as
be
Eric,
kidding me.
eye doctor, and we
Oh
also
yeah.
have somebody who wrote in, and we know all of us know this all too well. If you go to the urologist, sometimes the tables are not the lower ones, and there are lower exam tables. But if there's not a big call in somebody's practice, they don't even stop to think about that.
Right.
So I'm glad, Priya, you got a table at least. And you should ask too, and I say this to people who are on exam tables or people who are transferring to the car or to an airplane seat, take your cushion with you so that you put it underneath you. Now, sometimes, for the ladies, they can't have that cushion underneath you because they can't get to where they need to go. And so it gets very complicated, but anything you can do to help yourself, because if you're like at the urologist, you might be an hour laying on that table without a cushion. And yes, it is
Mhm.
padded, but it's not padded enough. So all those things, anything that you can do. I love the way that you all brought up how you spoke up for yourselves in a very non-confrontational manner, which is really important because you don't want to, you don't want somebody to be like, whoa, okay. But you have invited them into your world, which is really, really important. Um, so now we had, when the ladies were talking, all the ladies, I can't see you out in the audience, but I know you're all going, uh-huh, uh-huh, just the way I'm going, uh-huh, uh-huh. Because it's universal. if you have paralysis, if you don't have paralysis, it's all universal. It's all the same thing. You're like, scoot down on that table. No, the edge, I'm at the edge already. No, scoot down. And you're like, so all the ladies have been nodding in agreement. So Eric, we're gonna pinpoint you now. And maybe you want to talk about the gentleman's side with the low T and the ED.
Yeah, even low T and ED, that could be a, a bad situation or mental draining on anybody, even if you have a disability or not. As you age, you will not be able to perform sexually like you would when you was younger, you know. And but nowadays they just technology, and the urologists have all type of new stuff that I done learned about that you can use for ED and anything that you want to do. You know, once you get older, sexual sex sometimes is not 100% priority, but as a man and aging, you still have the desire to have sex. So I one thing I would say is the perfect partner is need to be available, and sometimes it all might not be about physical sex. Sometimes it could be about a touch, a kiss, or whatever. But as long as you age, you are going to have problems with ED. That's regardless if you have a disability or not. And like I say, it's a lot of technology out there. It's a lot of different toys out there nowadays. It's just whoever your partner is they willing to work with you with whatever you have to work with. But like I say, aging with disabilities is just this is part of it.
Mhm.
And that goes for if you're disabled or not.
I I so agree. And one of the things I was just gonna say is I feel like it's also always an uphill battle to make sure that healthcare professionals see folks with disabilities as sexual beings
Right.
still.
Right.
And you know, I know, you know, myself, I'm at a place now where I'm also dealing with menopause, with, you know, big changes to my body, to, you know, my ways of being sexual. And so all of that feels like it has this additional hurdle, right? Of thinking about how we ask and get help in a system that is set up to not really do all the things we need it to, whether we're disabled or not. But then that additional layer is part of what I think feels so hard, particularly as I'm navigating menopause and figuring out, like, you know, hot flashes on top of everything else, and figuring out, you know, all of these different pieces that are now affecting my body and my health in really new ways. Like getting to that new normal, honestly, this is rough, y'all. This is not easy.
Right.
Yeah.
But like I
Well,
said, it's just so much different stuff out there. It's the best to have the conversation with your neurologist, and you know, look around on the internet. And if you are part of any type of spinal cord injury group, you'll hear people talking about different things all the time. You just have to be open-minded and willing to, you know, try different things that works for you and your partner.
We head a little bit more into that menstruation, perimenopause, menopause. Let's take a few moments and talk about that, because Eric has certainly given us the story about ED, and you know, it happens, and sometimes men are surprised that it happened. What about the surprises with menstruation and menopause?
Well, I think women are actually surprised about that because we don't
Yes.
really talk about it. And it is a medical, that's, you know, like I did this thing about accommodations, and I did it from the perspective of how we accommodate women because they go through different stages of their lives with their period. If they want to get pregnant, then perimenopause, menopause. And yeah, it's just like I realize I just seen a lot of people. I think Halle Berry is kind of advocating for that. And she mentioned, she's like, when you turn 40, the doctor should just, you know, immediately be talking to you about perimenopause, menopause, what happens, how they can help you, that kind of stuff. So it's just like a thing that's not talked about at all. And I think also, to follow up what Kat was saying, they don't see disabled people as sexual beings, and then elderly people also are not
Right.
seen that way. So if you're elderly and disabled, you're like kind of, you know, even more not thought of in that way, I guess.
Well, I
So
can't speak on this part.
Eric, I was gonna say, I wish, you know, I'm a reader, right? And so I go out to try to find information for myself about things. And I read several books about menopause, and none of them that I read were really targeting or focused on folks with disabilities who are aging. And it just gave me this like immediate, Priya, I think you should write a book. Like when you were just talking, like maybe you're the person who needs to write about perimenopause and menopause from that perspective, because it's missing. It feels like a real missing resource. Yeah. So I'm just
Well,
gonna say
I'll just have to say I have neuropathy and spasticity due to my
mhm.
spinal cord injury. And you know, for years when I would kind of get my period, it would get worse, and doctors would be like, try birth control. Well, you know, they would try all these things. And I was just like, oh, I don't know. It seems to be, you know, the birth control seems to be making it worse. I don't know what's going on. So then and I don't go on Facebook. I don't really go to support groups and stuff that much. But with this, I kind of wrote, I'm like, because this doctor wanted me to get an ablation. Like they thought if they just cut off the entire system, that would
Mhm.
help. And this woman wrote on my post when I asked about, like, should I get this? Or she was just like, you know, I got that before my spinal cord injury, and I notice my spasticity neuropathy gets worse when my period's supposed to be happening. So she was just like, I don't think it's the period. I think it's the hormones and
Mhm.
stuff like that going, because and that's the science that maybe hasn't been studied. I'm not sure because
Right.
read a lot about that. But I just think kind of thinking, looking, testing how hormones and things affect the body, you know, maybe cause swelling in a certain part of your body and therefore makes your spasticity and neuropathy worse because your nerves are connected to all those things. So it's just I feel like they need to do a deep dive into how
Mhm.
hormones, testosterone, all that stuff that exists in all of our bodies, like how it affects us mentally and physically
Mhm.
for everybody, and then disabled people too, of
Mhm.
course.
well, of there's a lot of that, and I know I get a lot of questions about it as well. And you were talking about spasticity and, you know, problems, but also autonomic dysreflexia for some people. And, you know, it can lead to lots of different things. So it's important that we have I like that you asked people and got information about them. That doesn't mean it's going to be the right thing for you, but it's information that you could use to help process some of these ideas and comments. So that's a really good approach to do. We've gotten a lot of comments about from people about the exam tables, so we hit the right thing there. Yes, people are all familiar with that. Um, there is a women's women's health page on the Christopher and Dana Reeve Paralysis website, where there's a whole listing of all the problems. I shouldn't call it problems, the issues that arise with perimenopause and menopause and how to deal with them. So it's like, here's the issue in all women. Here's how paralysis, there's a chart. Here's how paralysis affects that issue. And here's some strategies of things that you can do to help control some of these issues. So, very important. Now, you
Linda Frost.
Oops. Yep. It looks like Linda might have frozen. So we'll just give her a minute and she will usually pop back in. So if y'all just want to continue your conversation on what you were just talking on, we'll give Linda a moment.
I thought it was me at first. Priya, you're still muted.
I have to say, I don't know why doctors' offices don't at least have one accessible table in their office. Because besides disabled people, you have elderly people, and they could not get on that high table and they could hurt themselves as well. So, and that's what I told them. I was like, you do know you have senior citizens coming here. What are you going to do if one of them hurts themselves trying to get on this table? So, yeah, I just think it's bizarre.
It would be nice sometime if you at a hospital sending the doctor, especially big hospitals that also have like physical therapists in there, that when somebody is coming in with a spinal cord injury or elderly or different disabilities, that they can call a physical therapist up, to help out with some of those transfers to those tables and stuff like that. A lot of I don't know if they want to spend money on equipment nowadays, So it would be nice to have somebody that can help out when it comes to doing those type of transfers to that type of equipment.
Yeah.
And I feel some of the doctors should be educated on not just the transfers, just laying on the table, to have a table with some type of cushion on it in certain areas when you are laying down.
I have to agree with you that wholeheartedly. That is one of
Yeah.
my things that really bothers me. So thank you. I'm sorry I had a little interruption there. Um, in what ways would the three of you like to see more support for the aging population living with paralysis? What would be your dream
My dream
besides the
would
cushion on the table?
Well, that was going to be the first thing. My dream would be that people like us that can educate hospitals and different doctor facilities about the equipment that they use when people with disabilities come in, even elderly people come in, to let them know that, you don't want to go to the doctor today and you laying up there for 45 minutes. You go home and the next couple of days you find out you're breaking down with a pressure sore somewhere, and it's no figuring out, where it came from. And when you go back to talk to them about it, they like, we don't know what you're talking about. They looking at the equipment, and it's not their fault. I just feel like they need to be educated on what type of equipment to have that'll be universal for all people with disabilities.
Yeah, I mean, and we talk about universal design, but that's just like for whatever building. But universal design for medical world is also very important, like Eric was talking about. It's like having those exam tables that are padded will be good for everyone. Like, it's not like a person that isn't disabled is like, oh, there's extra padding here, I don't like it. Like, they're not going to be bothered by that. And then it helps. So yeah, my dream is like the medical world just having that part of their education. Like, it's bizarre to me that when people go to medical school, they don't learn about how disabled people's skin break down, and they need to kind of keep an eye on that. Or pain, pain also. They don't learn about pain and how to approach it. Like, often they blame patients. Like, if what they give them isn't working and the patient's like, this isn't working, I'm not going to take it. I mean, I've been accused by the doctors, like, well, I prescribed you that medication and you didn't take it. It's like, it didn't work. So why would I take it if it doesn't work? So, it's like, I just think I think all three of us are very like outspoken people. We're not going to be like back down. So, and not everyone's like us. So it's just, I do it because I am outspoken. I say that for myself and everybody that maybe isn't as courageous as me to say stuff to the doctor. So
One of the things that makes me think of too is like the role and the importance for me, community, in building my resilience to be able to do that. You know, the all of us, I think, are pretty clear that we often don't get what we need from systems when we, you know, encounter them. But one of the places where I feel like I do really feel that sense of resilience building and crowdsourced, like, you know, adaptive equipment information and a sense of real sort of solidarity, I guess, is definitely when I am in community with other disabled people. And when we're able to share our experiences with each other, when we're able to like root each other on, when we're able to you know, create community in ways that I think benefits our mental health, but then also that ends up benefiting your physical health,
Right.
almost always, right? Like I saw you give the thumbs up, Eric. I know you work on building community, as do you, Priya, all the time. Like community is one of the core, to me, interventions that keep me healthy.
Yeah, I'm actually working on something right now too, trying to find out what the population of people with disabilities in my community and reaching out to them and making them aware of certain things that's going on in the community, not just in the community. I feel like the whole world should need outdoors should be more accessible for people with disabilities. I like what Cat is doing, making the world more accessible just for birding and different things like that. I spent a lot of time up in the mountains and there are some challenges up there, but it is certain mountains that you could go up now that has a pathway for people with disabilities. I think that's very important for our physical health and also our mental health to be outside. That's where I enjoy myself the most, is being outside, soaking in the sun and being able to, take on whatever physical challenges that's out there with trying to be as safe as possible.
I'm with you, Eric. And Priya, my wife has a t-shirt that says indoorsy. And I feel like whenever Eric and I are going off on our outdoorsy tangents, I
Yeah.
want you
no,
to
it
be able
just
to have an indoorsy sweatshirt.
well, I know. My belief is that disabled people should be able to do whatever other people do.
Absolutely.
So even though I'm not an outdoorsy person, I totally support the excess. I always tell people nature isn't accessible, but people did make it accessible to them. And now it's
Yeah.
time for you to go to the next step to make it
Yes.
accessible for disabled people. So,
Yeah.
Yes. Mhm.
Well, those are some really great ideas, and I think everybody does their advocacy in their own way, and you guys are certainly advocates. And there's a question about advocacy, about can we get legislation? And we at the foundation we have an advocacy department, and so we're going to turn that statement of Judy's over to them so that they can see what they can do about getting some kind of equipment that's accessible, and how we can work that. But that would go through our advocacy department, which is a fabulous group. So we have some questions that people have written in, and I want you guys to give me your thoughts about some of these. So there's a person who has no function or feeling from the waist down. They're bedbound for 5 years. Now their thighs are rotated out and their Achilles tendons are tight. Is there a way to prevent this from worsening? Have any of you three had experience like that?
I have a friend in a similar situation, and what I noticed, I know back in the days when you have that Achilles situation that's tightening up and stopping you from doing your transfers and stuff, they would cut it. But now I know more of people using Botox to loosen that up.
Correct.
Yeah.
Yes. Botox is very good, and you can get boots to wear in bed to help your legs stay in alignment with your body. And you can get bolsters that has to be medical grade equipment. Sometimes people will want to stick a pillow in there to kind of prop the hip up because the foot will tend to rotate out when you're laying in bed on your back. And but get medical grade equipment, because much like our friend Eric has said, those pillows collapse and you don't want to get a pressure injury while you're trying to help yourself. So you should be able to get with that problem. You should be able to get some equipment. Anything you can do for spasticity without including drugs.
A lot of people actually is also using Botox for spasticity.
Right.
I
Right.
have a friend right now is using Botox for spasticity. Sometimes they even give you the whole what is it, the baclofen pump to
Right.
help you with spasms and stuff like that. I know the more you can stay stretched out and not be so tight, help you with spasms.
Bingo.
Yeah, I think stretching is good. Like if you can stretch every day, whether you can do it yourself or have someone do it for you. And for me, I use a TENS machine, an electrostimulated TENS machine. It really works good for my spasticity. This isn't for everyone. And I've tried baclofen. I never have tried Botox. And I don't know, doctors were just never into trying that for me, which is, I don't know. But if you don't want to use drugs, I feel like heat, hot water bottles. I have this sock. This is like, I think, an old style, like heating thing people did, would put corn or rice in a sock and heat it up. And so I use that. And be careful, don't burn yourself, because if you don't have sensation, you might have something hot, which I have done. So
Me too.
yeah, so be careful with the heat, but heat is really good. And then I also have used this, it's called an ultrasound therapy. It's like kind of an ultrasound TENS, and what it you put like gel, and you keep this ultrasound device, but you should just keep be careful with that, because don't hold it in one spot, move it around. And for Chinese medicine, I've used moxa before, but that's a lot of smoke, and people don't like the smell, but that does seem to loosen spasticity. But all of these things, of course, loosen it, temporary, because spasticity always just seems to come back. So I don't know if Botox kind of just keeps it loose. I'm not really sure, because I've never used that before. So
Yeah, Botox
so
will
those are the
affect the
few things.
muscle. Yeah. But yeah, spasticity will come back, but stretching out, the muscles want to contract. That's what they want to do. And so anything you can do to stretch it out and exercise it, that's always a big help.
And I
Kat,
do
did you?
want to get back to this point you were talking when someone's like, fight for what you need. I actually got the Medicare and Medicaid paid for the standing wheelchair, which I have. And they were like, it's going to get rejected. You'll have to appeal. So I was like so freaked out. I called all my doctors, all my physical therapists, like any medical person. I was like, send it to the wheelchair company, tell them I need this wheelchair for whatever reason you want to say. And and I got approved, and I couldn't believe it. I was like, oh my God, yay. And I got, but I do, because people are like, oh, you're like a magician. I was like, no, not a magician. I just got really freaked out and got every single medical professional that saw me to write a letter and say, yes, Priya needs the standing wheelchair. But I find the standing wheelchair also helps with the spasticity and stuff. And if it kind of like, if it's more towards at night, and and I'm feeling, sometimes I'll stand just to stretch all that stuff out, and it works pretty good. So
And it helps your bone
yeah,
density as well, because there's somebody who
yeah,
wrote in, should I get a bone density test? Yes, if you're not standing,
yeah,
you need a
definitely.
bone test. And then
I
you
mean,
need
that's why I worry about the transferring, because I am aging, and when you are paralyzed, your bone density is even less than a person that walks and stuff all the time. So yeah, I just kind of worry about that, because I don't want to do some weird thing trying to get up the stairs and then break a leg or ankle or
Yeah.
something.
Absolutely. Now we have another person who wrote in about sagging skin. they became quadriplegic and their skin and their arms and their necks just gotten saggy. Anybody had an issue with that?
I mean, saggy skin come with aging, period. I definitely don't know if we can do anything about it, but it's just, part of life, like without a disability, long as you get older, you're gonna have skin in certain places that sag. I don't know. I don't have no answer for what you do about it though.
Yeah, I don't know if that's necessarily like something that is related to paralysis, but yeah, aging things sag, and that's you just
Yeah,
have to
it comes
accept
to
it.
us all in different ways, doesn't it?
Right,
Yes.
yeah.
Um, let's see, there's a couple more questions about oh, here we go. Somebody with has some pains in their feet, numbness and pains. Any advice um about what to do about numbness and pain feeling? So they must have some incomplete kind of injury or a medical diagnosis for paralysis.
Yeah, I have a incomplete injury, and I always have a little numbing and tingling in my feet. I use one of those massage guns. I just put it on the bottom of my feet, turn it on the low setting, and rub it up and down there. And I can't say that it takes it away, but it make me feel a little better.
Yeah, it takes the edge off
Yeah,
basically.
yeah. Maybe
I've
it's
used
a mental thing, and by using something, it helps. But that's all I use for. And every now and then too, I will use a TENS unit.
yeah. And then like sometimes I use like a I don't know if it's the CBD, but it has like this menthol in it. And
Yes, yeah,
and I think it's the menthol. I don't know if it could be CBD too, but the menthol, I don't know, it just kind of takes the edge off. It doesn't get rid of it, but it does take the edge off for sure.
All third tens units and Tiger Balm, which
hmm
has that
Yeah, tiger.
menthol
hmm
property as well
Right,
for
right.
pain. Hmm.
Mhm.
And a lot of other people I have heard in the spinal cord injury world, they also use THC.
Mhm. Yeah, in states where it's medically accepted, I've met
Right.
a lot of people that have used medical cannabis for
Yeah.
those reasons. And I lived in California, so I did find it cuts the edge off. It does not get rid of it. So just to
Right.
let you know, you're never going to get rid of it completely,
Right.
but it does, like, it helps you deal with it.
Yeah, I think if you can use your mind to focus at you doing something about it, mentally it helps you right away. And just like you say, it probably don't get rid of it, but long as you see yourself doing something about it mentally, it might help you.
I also think keeping your mind busy
Hmm
is a really good thing. Like, I think that's the best medicine is just keep yourself busy, whatever it is, like, activism or art or whatever. It's just, I don't know, when you're doing things and planning things, all of a sudden aren't really thinking about the pain. I think when you sit there and just constantly think about, like, I don't know, when I first had my injury, I was like, I need to figure out how to get rid of this pain. And so I would be constantly figuring it out. But, then I realized, okay, that was not the path for me. So yeah, so I just find keeping myself busy mentally really makes me not think about the pain.
Yeah.
I love, there are all kinds of different resources, but for chronic pain in particular, one of the things I've really appreciated is a book called You Are Not Your Pain. And it helps because for some of us, the pain is always going to be there. There's not a way around it. And so it gives, ways to do mindfulness. For me, that's through birding. For, somebody else, it might be through clay or activism or whatever it might be, but finding ways like you were talking about, Priya, to like to use a different part of your brain helps reduce that chronic pain, then helps you be able to live with it, because we can't get rid of it, right?
And it makes you happier.
Yeah, it makes you happier. Come bird with me, it'll make you
It's like a
happier.
distraction.
Yeah, definitely.
Yes.
And I would love to go birding with you. I've never done birding, so I would
Yay.
love to do that.
We're definitely going to figure out a time in North Carolina and we'll bird together.
Yeah, you should come to Asheville and do some of that work here, because I know there's
Yeah.
a lot of people, like Colorado and Asheville have a similar geography.
Yeah.
Colorado's just bigger, I think. or something.
Okay, so we're all going birding, that's for sure. Well, thank you everybody for your
Yay.
participation. And there was one last question about, are there support groups for people over 50? And we do have that peer mentoring program at the Reeve Foundation. And so if there's anybody, any question, any issue that you have, be sure and contact the information specialist at the foundation, because they have information about every single thing and there's no cost to you. So it's a wonderful opportunity just to be able to contact. So to our three presenters today, I want to say thank you to Priya, Cat, and Eric. It's been wonderful talking to you. Such valuable advice. I just love talking to people and hearing what people do out in the community and how they've managed things. And you three are so in charge, and I love it.
Thank you.
So it can be an inspiration to some of us who are a little more timid sometimes. I'm going to think of you guys when I have to go to the doctor, and I'm going to be like, I'm not scooting down on this table anymore. Okay. But I'll do it
Well,
in a
because
nicer.
you're their boss, they're not your boss. You just remember that the doctors are not the bosses.
That's right. That's right. But I really will take that message home with me. So thank you everybody for coming. It's been a delightful hour.
Thank you.
You're welcome.
Thanks for hosting this.
Yes.
Yeah, great.